Take care of your teeth with a root canal. There are some terms and phrases that just get a bad rap through society, no matter who has experienced it or not. For example, who thinks that going through a root canal is a fun process? Usually no one thinks that because a lot of people don't want to go to the dentist. What is it about this dental procedure that has people running for the hills, even if they've never been through one before? Isn't it meant to improve the health of your teeth? What are root canals? A root canal is a process that the dentist goes through when there's a tooth that has severe decay or damage. It might also have become infected and requires immediate cleaning in order to stop the infection from spreading and becoming a real health issue. What's the big deal with either of these? The dentist has to work under the tooth to get inside to the nerve and the pulp of the tooth. The infection or decay needs to be cleaned out before the process of healing can begin in the tooth. If the decay or infection is not all removed, then the tooth cannot be saved or it could be in danger of falling out. The dentist will remove the stuff that needs to be removed. And then the dentist will begin the process of putting the tooth back in place and sealing it up to keep more decay or infection from setting in. The process takes a while because of the small space the dentist is working in. It's hard to see and maneuver inside of the tooth, so there's a lot of pressure used on the jaw in order to keep the mouth and the area wide open. Since the nerves are being handled, there will be a lot of numbing agents given in the form of injections, which are not too popular with many people. Even though the root canal is being done to save the tooth, people don't like the process of the shots, the drills, or the repair work in order to keep the tooth or teeth safe for the future. Aftercare of a root canal. A root canal takes a bit longer than a filling when you have dental work done. Since it takes longer and it's a different process, there might be more pain involved afterwards. Once the numbing agent wears off, the dentist might suggest some over-the-counter pain relief, or they might even give a prescription for mild pain relief to get ahead of time. The pain relief medicine might only be needed for a couple of days if there's pain or pressure in the jaw region. An antibiotic will probably be given for a week or two to ensure any infection is completely gone in the tooth. Follow the written directions the dentist gives in regards to when to eat again and what food you can eat. Chewing might be a sore process for a few days until the gums and the nerves are completely recovered. If you do need to have a root canal, your dentist will give you plenty of information about the procedure and will make sure that the procedure goes smoothly.